Having healthcare be made free is a very controversial topic in America, but at the very least, it needs to become more affordable so Americans can have proper healthcare access. Did you know, according to a study done by West Health in 2020, that an estimated number of 112 million Americans are struggling to afford healthcare, and with the population rise, that number can only go up. Living costs are expensive enough as it is, and we expect American citizens to still be able to ravel up the money to afford life-saving health care. Some citizens are not as fortunate as others to be able to afford the best insurance, have the best job, have the best education to get said job, and also support their family. At the very least, we can advocate for an equal opportunity at a healthy, comfortable life. When we think about affordable healthcare, this is not only to support those who cannot afford it, even though it is almost half of Americans. Focusing on affordable healthcare also promotes effective healthcare, which saves money to work on other countrywide issues. Statistics tell us that hospital spending in the United States is 25% dedicated to administrative costs, nearly $200 billion, in comparison to Canada, that only spends 12%, and Europe, that only spends 16%, and they have free health care, and their health care is not proven to be any lesser than America's because they spend less money on administrative costs. If nothing changes, healthcare may even become more expensive on an average incline. For young Americans, even buying a house is nearly unattainable. Public health promotes the health of everyone. Everyone spent years in quarantine during COVID-19, and evidence supports that many countries had a higher ability to manage healthcare than America. Europe had 28% less deaths according to the AAFP, and that was only put out in 2019. And considering how many deaths occurred in total, that is a substantial amount of lives saved. If no policies change to promote affordable health care, we will have a deep impact on the ability to make sustainable and systematic improvements to care, equity, quality of care, and cost control. For the sake of the well-being of American people and the American economy, voters need to support policies that will actively lower the prices of health care. Every human is deserving of having their needs fulfilled. American spending needs to be reprioritized on the benefit of the people. The cost can be spread more efficiently and help healthcare become more attainable. Healthcare is crucial to be available to everyone, regardless of income. Healthcare needs to be made so that even the poorest people can afford the best health care, and health care does not need to decrease in quality if we decrease on our spending with the attainable prices. Administrative costs do not need to be up to 25% if countries with free health care have almost 10% or more less administrative spending than America, and somehow still have the same quality of health care that everyone has access to. The poor need access to health care. Everyone needs access to health care at the end of the day. Everyone deserves an equal chance at being healthy. We need to have healthy workers in America. We need to have everyone healthy so we can expect people to work their jobs and have just a sustainable economy in America. Thank you for listening. That was my speech on affordable healthcare needing to become more affordable or free as a good end goal. Thank you for listening.